Health visitors' advice on flat head syndrome and whether these helmets actually help. So some babies do develop flat head syndrome, especially after the first couple of months, and usually this is due to them spending a lot of time laying on their backs. But of course we do recommend that when they sleep they are on their back. So there are two different types of flat head syndrome. There's plagioccephaly, which is usually when it's flattened on one of the sides. And then I think I pronounced this one right, it's brachycephaly, and that is more when the back of the head is flatter. Flat head syndrome is quite common. It happens usually to at least 1 in 5 babies. In most cases, it is not a cause for concern. I know parents don't like the look of it, but it doesn't cause any harm to the brain. It's not being squashed or anything. It doesn't cause any pain or discomfort for the child. Of course, if you're seeing there is pain and discomfort, then that's something to discuss with your GP. But on the whole, flathead syndrome does not cause pain and discomfort. So it happens because when babies are born, their skulls are very soft, and this is so that when they are pushed out of the birth canal that they can squeeze together, and that's why you've got that soft spot in the centre, because it hasn't fused together yet. So this obviously means that it is susceptible to changing shape. So if a baby is laying on their back for prolonged periods of time, then it can cause it to be flattened. Being premature can also put them at a higher chance of having flat head syndrome because their skulls are softer because they were born earlier. Also, neck muscle tightness can cause this, and also the way that they lay in the womb. If they had a preference to the side that they laid in the womb, then it can tend to be that the head can have preference to lay that side when they're born. So what can you do to help? Lots of tummy time. So just remember, tummy time is also when they're here up on your chest. It doesn't have to be laying flat on the floor. Wherever they are, where their head is being unsupported and they're kind of having to practice strengthening it, that is tummy time. So lots of tummy time. Carrying them in a sling instead of maybe having them in a sloping chair where their head's going to be leaning backwards. If they favour facing one way, like I said, if they did in the womb, having toys or things that are reflective or attractive for them to look at on this other side, which is making them work a bit harder to turn their head round. So to reiterate again, when they're awake, trying to reduce the amount of time that they're laying on a firm, flat base, basically. If your baby does continuously struggle to turn their head, it may be that you do need to speak to a GP or your health visitor, because it might be that you require a referral to see a physiotherapist. Now let's talk about these helmets that parents see other babies wearing, which are meant to help with preventing or changing flat head syndrome. They aren't recommended by the NHS. There is such limited evidence that these actually do anything to help prevent or change the shape of your baby's skull. So like I said, there's no evidence they actually work. They can cause some skin irritation and rashes where they're sat in the same place if they're getting hot and sweaty under there. They're expensive. They can cost up to £2,000. Babies grow so rapidly that they constantly have to be checked to see that the head hasn't grown too much for the space that it's being squeezed into. And they can be uncomfortable. Usually your baby's head shape, if you try and prevent laying flat as much as possible when they're awake, will return to the shape by 1 to 2 years latest, by the time that the skull has hardened.